Last spring, this was the standard call echoing in hospitals for ICU patients.
81-year-old male from a nursing home.
Now the standard has changed. The patient's much younger.
One of the first times I had to intubate somebody who was 22 years old in the ICU the other day.
This is something we only saw in older people in the last wave. A lot of these folks are essential service workers as well. So they're working in, the Tim Hortons, they're working frontline stuff, they're teachers. These are people who weren't partying.
And it's across the country.
Dealing with a young person who is being told, I'm going to have to put you on a life support machine, starting to be tearful, and then, calling their mom to say essentially their goodbyes, because there's no guarantee that breathing tube will ever come out. Is really difficult to watch.
In parts of Ontario, the surge has begun pushing wards to the limit.
Nearing or at capacity, every day is a challenge, and trying to determine how we're going to manage the care of these patients, also taking a look at our staffing.
And while the third wave has yet to crash everywhere, healthcare workers worry about the potential for dangerous socializing over the holiday weekend.
COVID does not care that the person that you're visiting is your mother or your aunt or your friend. COVID understands transmission, and that's the only language that COVID speaks.
A message many public health authorities still won't enforce with action. Ontario's latest restrictions leave retail and schools open, while in Alberta, where the more transmissible variants of concern are a third of all cases, there are currently no new restrictions at all. Rafi Bujikani on CBC News, Edmonton.